Thank you, sir, for making time. I know the campaign trail keeps people busy, so appreciate you being here. Thank you. Tell us how the campaign's going, just to start. Give us an update.
Well, in about an hour, I'll be in Keynote, so it's busy. We were in Fairbanks yesterday, Seward the day before, traveling quite a bit, making sure that people hear about all the issues that we want to talk about in the campaign. It's an interesting time. It's a very toxic time in politics. I mean, it's tough to turn on the news at night. I try not to anymore. I feel like sometimes I'm a bit player in a reality show, and I'm not anxious to see all that. But what we're finding is people, the issues people care about it. What's going to happen with public safety, education, what's going to happen with the dividend, the budget, the economy, and how we're going to diversify it from oil and gas. I mean, it's kind of the basics that people care about. And people are looking for what's going to happen in the future. What is not just about the next session and the next legislative process, but what's going to happen now that's going to have an impact 5, 10 years out. That's what I hear constantly from people, is they're tired of the kind of day-to-day combat of politics. What they're interested in is, what are we going to do today that 5 years, 10 years from now, our kids, their kids will want to stay and live and work in Alaska. And when you look at the statistics, they're not very promising. We're number 1 in crime, number 46 in education, number 1 in unemployment, number 50 in infrastructure and investment in our state. These are not statistics that give you a sense that there's a long-term future unless you do something today. So it's exciting time. We're busy. As I tell people, this is the last 25 days, give or take a few hours, that you have to be out there talking to people every single day, every minute. And some of my days, there's a lot of communities that don't have a chance to come to meetings like this and have these conversations, that are working 1, 2, 3 jobs sometimes, and I go wherever they are. Last Saturday I was at a meeting, if you can believe this. It started at 11 p.m. It was the Nigerian community that work a lot, and this is when they get together once a month. And so when I was driving out there first at 9:30 p.m., I got a call and said, "We're not ready yet." And I thought, 9:30 p.m., how can you not be ready yet? And they said, "We are still gathering." And when I got there at 11, there was about 100 people there.
Wow.
So there's a lot of that happens outside of the normal workday that it's hard to see if you're not out there. And I believe that you can't wait for people to come to you. You got to get there, go see where they are, and understand the challenges they're facing.
I should say, logistically, we invited each of the 3 candidates after the primary. We invited the governor earlier because we knew obviously he wouldn't be on the primary, he'd be on the general election ballot. You were the first person to get back to us, and I understand everybody's down in Kenai later today, and that's why you got the morning spot, but we did invite everybody. You've had a career obviously in local and federal politics, been in a number of positions. Last handful of years, of course, you've been back in the private sector. Certainly during your time as a U.S. Senator, you talked about healthcare a lot. I'm wondering what your time...
Yes, I did.
I'm wondering what your time in the private sector has offered you in terms of experience and additional insight on healthcare in general, and what you would bring, therefore, to the governor's position.
Well, it's not much different than, I've been in the private sector almost all my life. From the age of 14, started my first business, and I've always been in private sector because it's given me, honestly, the ability to serve the public in some form, maybe on boards or running for office. And so I've seen it from a lot of viewpoints, not only from a public policy, as you described, but even on our personal life. We didn't have, when Jacob was born, we didn't have maternity coverage. We had catastrophic in case there was something going to happen, but we were fortunate. Providence Hospital carried us for several months after the birth, and we had no complications. So we see it from, and I say we, our family, because my wife has several businesses. I have a corporate business and another resort business, and we spend a lot of time managing those issues around healthcare. But the other thing is, as you're out and about, you hear not only on the campaign trail, but in the private sector, you see these challenges that people have and how to manage this ever-growing cost for healthcare. And I think one of the challenges we have, and what I hope to bring to this office, the governor's office, is a little more innovation to how you solve this problem. Because when you think about it, and the cost of employment when you're dealing with folks. For example, you know, when there are people who want to push against Medicaid in this campaign, and you know, and I'll be very blunt about it, Senator Dunleavy doesn't think Medicaid should be expanded as it is. The problem that people don't understand is Medicaid, you know, the general public has this sense that Medicaid is for people who aren't working or lazy, not doing anything. Well, actually, Medicaid, when you walk into some of these large retail stores, a lot of those employees are on Medicaid because they're not getting livable wages. Mm-hmm. And so somewhere that's compensated, and we're paying that bill. When you calculate in the Alaska Native population and the overall population of Alaska, upwards to 200,000 people are eligible or on Medicaid. And that's a lot of working folks. And then on top of that, and you all know it better than I do, you take care of a lot of seniors, elder care with Medicaid. So there's a misnomer of what it's about. And I think the private sector, not the medical private sector, but the general private sector, I think has a misconnect here. You know, they think, wow, those are people, government shouldn't pay for this. Well, someone has to pay for this health care, because if not, they're going to end up in emergency rooms picking the highest cost space, and then when that cost has to be shared, it's going to be shared with the insured and self-pays. And people, you know, don't see that. All they see is, I got my care, I'm out. Yeah. And what they're forgetting is there's a lot of people who can't afford that care, and Medicaid helps compensate that. And hospitals and other practitioners have been fortunate because the expansion of Medicaid, which, you know, when I was in the Senate, that was the one big thing that we worked on. The other thing I would say that I've noticed, and now even more so in the campaign, and I knew it was out there as a challenge, is, you know, fastest growing industry for Alaska is healthcare. And yet we don't have enough coming through the pipeline to grow our own. And I think this is a significant problem for us. If we're serious about this, dealing with healthcare, not only from a cost factor, we also have to figure out who we're going to employ in this industry. And you know, the Bethel Hospital, beautiful hospital being constructed, but a sizable amount of those employees will not be Alaskans because we don't have the workforce to fill that gap.
I want to give everybody an opportunity to ask a few questions. So I know we've got a couple of volunteers that have microphones, so you can just raise your hands and I'll get you a mic. I want to ask you, you're a proponent of Medicaid expansion, have been since you voted on it in 2010. As governor, in the first legislative session, what would you propose, or what kinds of things would you put into the conversation related to Medicaid reform and improving that model?
Yeah, you know, I've kicked around some ideas. Most of the people I've talked to about this like this idea. First off, you got to look at what the situation is with Medicaid. Medicaid is, you know, an $800+ million cost to the state, and it's growing. And the legislature always thinks by cutting it or not funding it, suddenly magic will happen and the cost will go down. Well, that's not really how it works. And so you got to deal with the funding issue. But more importantly, you have to be a little more creative. And let me give you a statistic. Let's say this whole audience is all Medicaid recipients. About some of you will file for some of your services and try to get coverage, and you'll be denied. You'll have to go through an appeal process and so forth, and then the majority will get covered. By the time you're done, 95% of the people in this room, if you're on Medicaid, will get covered for the procedures that were performed. The challenge is, as you know, the healthcare costs, upwards to 30% of the cost of delivering this service is administrative overhead. And one of the challenges, I think, is we're doing this huge cost of administrative overhead for a very small percentage of people that aren't going to get covered, about 5%. So why don't we change the model? And here's the example. And people say, well, how can you do this? Well, if you don't think about it, you can't do it at all. You got to start thinking about these ideas and try to push the envelope. For example, let's say you're a general practitioner. I come to you and I say, well, your average pay is $250,000 a year plus benefits. Here's what I'm going to do. I'm going to pay your salary. I'm going to pay your benefits. You're going to take every Medicaid patient. In exchange, I'm going to judge you on outcomes, what the product is, and the individual coming out, but also you're not going to have to do any more paperwork. I'm done with that. Because the reality is 95% of the procedures you cover, I'm going to pay as a Medicaid payer. So why would I spend all this time to have you build a back office system to figure out if it's a left arm or a right arm, or you got the right code, or you have to change the, you know, maybe you're in here for a wrist issue, but I got to make sure I get covered, so I work on a different coding. You know, we know this happens. So why not just say, we're going to deliver the care? Yeah. Or when I was down in Seward, and I was talking to the clinic, and they were talking about some of their nurse assistants they need, but their average pay is around $15 an hour. So we're not going to get anyone for $15 an hour to move to Seward. So I said, well, you know, if you take Medicaid patients, why don't we do this? Why doesn't the state come along? If you're working on a 2,080-hour year, that's about, let's say, we say we're going to give you $7 an hour additional, so you can pay them $22 an hour. That will cost the state about $14,000, $15,000 a year to give them an assistant that they need to, to bring down to small communities. It's trying to be creative. Instead, what we do, we use the same broken model and say, well, it doesn't fit. Well, then we should think about how to change it. And this is what I would be doing immediately, because this is an ever-growing cost. And also, we need to figure out how to do something different. And we're a closed system in many ways, as you know, so we can try things. That's what I would be doing, as just a couple examples. And these came from ideas that people have given me from the private sector or challenges that people are facing.
I see one question over here. Let's get a microphone to this gentleman. Well, I'll ask you while she's walking. This is in the weeds a little bit, but one idea floating around is that of a healthcare authority where the state would use essentially its purchasing power to unify and centralize purchasing on behalf of state employees, retirees, and other public employees like school employees. Do you have an opinion about healthcare authority model? Yeah,
I'm not sure the authority would work in a couple ways, and I say this because you have multiple jurisdictions of union plans that they like their plans, and they appreciate how they're working. So they would probably tell you, why don't you join our plan, because we're much more efficient. That's what some will tell you. But I think there is the premise of what you're talking about is using the purchasing power is the exact thing we should be doing. And figuring out how to use that may be from prescription drug components to certain basic procedures, or changing the dynamic of how you deliver the service. And as I gave that idea on the general practitioner idea, I don't care if that person works for the hospital, clinic, or their own practice. I don't really care, because the goal is to receive those patients. So, if the issue is always how do you get the costs down and managed and deliver a quality outcome, then you use the purchasing power of the state, and there's a lot of it between Medicaid, retirees, and active employees. And you can do that, but I'm not sure the authority, because you have multiple jurisdictions. You'd have to walk through it, and I know there's already opposition to it by some groups.
Yeah, good. Sir, why don't you introduce yourself and your organization for your question?
Hi, my name is Thomas John Nelson. My friends call me John. I'm a financial advisor, and for 15 years I've been talking about we think there's issues with Social Security and Medicare, but we don't even see the issues with Medicaid. There's not enough oil in the pipeline to protect Alaska when this Medicaid time bomb goes off. How do you expect to address the costs and how to pay for that? Thank you.
Well, I just gave you a couple examples. If it's all about just throwing money at it, then yeah, you're not going to solve this problem. You can't just churn money and have the outcome to be this, lower costs or controlled costs. You have to do some new innovative approaches to delivering health care. And if you don't do that, then you're going to end up in the same pattern of just going down to the legislature, trying to grab money, fund the budget, and hope it all works. We also have, 70% of the people on Medicare are chronic illness, preventable disease. But we have no real programs to deal with prevention within the Medicaid system. And this, to me, is like opportunity knocking at the door. Let's assume $800 million is our annual expenditure right now. If you could just shave 5% in prevention in dealing with chronic illness, suddenly you're talking $40 million. And here's an example for those that may be familiar. When I was mayor, we had average increases of 11 to 13% on an average annualized basis for our healthcare system. We went after it. We looked at preventive care. We said, if you got high blood pressure and you want to set a goal, or you're overweight, or you have high cholesterol, whatever those goals are, we're going to have you monitor those, and then when you achieve those goals, we're going to give you a Visa card, and we don't care what you do with it. You're just going to go spend it, hopefully not on bad, high fat content food that's been fried, because you're hopefully getting better. But the idea was how to move and incentivize the workforce, which an average age was growing to about 53 to 54 years old, which meant higher costs. We were able to, with that and a couple other things, move our double-digit increases back in 03 to 08 down to 0.5% in the final year, because you incentivize prevention as a component of it. But what we do in the legislative session does this. People forget that the session in Juneau went through 8 special sessions in the last 2 years. 8 special sessions. And they're so busy worrying about the incremental financing issues, they forget the big picture. If you want to save money, you got to look at the system and radically change it to deliver better outcomes and lower the costs or stabilize the cost. That's how you got to do it. Otherwise, you sit there going, well, how much more do we got to pay this year? And that's not really the way to do it.
Let me ask one of the topics that is a hot button issue that the Walker administration has touched on but not brought resolution to is this, again, another in the weeds issue. I'm sorry to do this to you, but I'm sure you've heard about this issue of the 80th percentile payment, which acts essentially as a floor for provider charges while at the same time providing consumer protections against balance billing. In a state considered to be a high-cost state, is that an issue that you believe your administration would want to take on, or do you believe that is largely settled?
No, we're going to have to look at, I mean, you have to look at all these issues, and I know every time I say this, I have usually someone come up to me afterwards that you don't understand the issue, let me explain it to you.
We have a panel on it today.
Oh, very good, very good. But the issue, you know, you have to look at all these things. You can't just say in the healthcare system that we're going to isolate issues off the table and no discussion, because it's a holistic approach. You have to look at this. And so this is part of the equation. We're going to have to look at it. As a high-cost state, that does have an impact. It's sometimes, you know, the way I describe it, sometimes you're chasing your own tail. And so you got to be careful on this one. But you can't, you know, I'm not going to be afraid to look at this issue and see how it can be modified, or maybe it stays the same, but how we look at the system and overall and how it impacts it. You have to.
Other questions from you all? Let me ask about just some basics when it comes to the sort of Alaska election, and you've addressed these multiple times, but I'll just let you address them again. PFD cuts, protections, what are your views on a long-term sustainable PFD policy?
Sure, and I know you have a couple legislators in here, so this is not to disparage them, but here's the problem. Now they have it set up where it's a percent of market value, which means there's a percentage of the 5.25% of the full value of the permanent fund dividend. They come up with an amount of money, and then they split it between a dividend and general government or funding of general government. The problem with this is it's left in the hands of the legislature. So every single year, here's going to be the debate. How big is the dividend? How small is the dividend? Who should get the dividend? Instead of focusing on health care, education, crime, they'll be stuck in this box because they can't get out of it, because it's a political box they've built for themselves that they now can't figure out where the door is. And this is a problem. So my approach is, and you can see it because the last 4 years between the governor and the legislature, they burned through 80% of our savings. $14 billion gone. No longer there. No longer a tool. If you talk about financial management, it'd been a nice tool to have in the savings account to be able to manage in some way. So here's how I would deal with it. The corpus of the fund, the permanent fund has about, between the corpus and its retained earnings, about $65 billion in it. 18 billion of it is in retained earnings, which means that the legislature can touch that, draw that out at a simple majority. I would take about 14 billion of that, shove it right into the corpus. Only then the people can determine that. Why do you do that? Because if you have this money on the table, proven that they have shown us over the last 4 years, they will use this money, take a little bit out each year, a little bit out each year, a little bit out each year, and before you know it, it's all gone. Now you have no money for long-term sustainability in the budget. So what I would do is take 14 billion of it, shove it in the corpus, only the public can touch it, and they can't go after it. Second, you would take the dividend, use the percent of market value that they've laid out. 5.25% is a little high, but let's say you use that formula, 50% in a constitutionally guaranteed sustainable dividend, the other 50% going into constitutionally fund education, K through 12 plus pre-K. So those two issues are no longer on the table of a legislative session every single year. Because when they do that, the net result is they end up spending the last week debating how big, they will debate how big the dividend is or how much they're going to throw at education or take away from education. You take those two things off the table. Why do you do that? Because now they actually have to make a decision on revenues. You're going to need revenues long-term to solve this budget issue. 500 to 700 million, give or take. And the public, the only way the legislative body, and I've been in both an executive as mayor and a legislative bodies are on 2-year lifespans. All they're trying to do is get to the next 2 years. It is very hard, no matter how committed individuals are, to think long-term. So you have to take some of this kind of free cash off the table. So it forces them into a decision. If they would have done this the first year when the governor came in, we would have had 10, 12 billion sitting in the corpus additionally. The Constitutional Budget Reserve wouldn't have been spent, and we would not have the gap we have today. But when you leave the money on the table, they'll take the path of least resistance. So you got to kind of box them in and then say, now we're going to make a decision. And that's how you got to do it.
You have distinguished yourself in your career as being very environmentally minded when it comes to policy. Last week's report from the UN that said we have less time than we thought for people that are keeping an eye on climate change. That 2030 is sort of our near term before we get into catastrophic changes. Many of those changes are being felt acutely in Alaska, villages that need to move from the shore, mosquitoes that get bigger. They're already pretty big.
Well, they're big here. They're just now bigger in North Carolina.
Yeah. How do you reconcile the dependency on oil and gas in the state, extraction state, with this increasing body of mainstream science that says things are moving more rapidly than we thought towards an end that we may not be able to come back from?
Well, I think it's a combination. I think we're always going to be an oil and gas state to a certain level, but there's things we can do. You know, as a state, we have set a goal of getting to renewable energy for internal consumption, 50% by 2025. They're never going to get there at the rate they're going because they're not really committed to it. It's kind of a talk and not a real investment. And we should be investing in this. When you go to Western Alaska and you see these incredible wind turbines producing clean energy at a lower cost than they were buying from their diesel product, that's a huge plus for us. Mm-hmm. On top of that, if you can produce, doesn't matter if it's solar, wind, geothermal, hydro, whatever it might be, if you can do that here in Alaska, you can do it anywhere in this world. And we should be on the cutting edge of this technology. And in some cases, we're experimenting to certain levels, but we could be doing a much better job in this arena. That's our part in Alaska. The other thing is, sooner or later, you know, if you believe in the pipeline or not, the gas on the North Slope is going to be monetized at some point. And a big purchaser of that is going to be in the Asian market, China more than likely. Well, why is that important? Because their big production of energy is coal and utilization of coal. So if you're going from coal to natural gas, may not be perfect in the sense of climate change. It does have a direct impact to less emissions in our air quality than ever before. Mm-hmm. But you know, when you're down, and I was down in Southeast Alaska going to the university, one of the biggest challenges with climate change right now for one of our biggest industries is fisheries. Fisheries is having an issue with acidification and warming of waters. So fish are moving more north, acidification has an impact. And in Southeast, the university there is actually doing some experiments with shrimp to determine what certain levels of acidification of the water does or doesn't do to them, the warming of the waters, different temperatures. Why are they doing that? Because these two issues, if we don't figure this out, our fishing industry is going to be jeopardized significantly. And we don't want to go to farm fishing. We like our wild caught, and this is an important part of the analysis. But when you go to their space they're working in, it's no bigger than this stage area. This is probably bigger, actually. It's way bigger than what they're working in. Mm-hmm. And that's a really sad state of affairs when you think about just that UN report. Mm-hmm. The other thing is you have to acknowledge it's real. You know, I'm born and raised here. I've never seen a fall last this long until last night. You know, I don't know if you were woken up, but early this morning when it I don't know what was happening, but when you opened the door, it was pouring rain. Yeah. But you know, we've never seen a fall like this last this long. You know, Fairbanks, I was just up there yesterday, and it was fairly warm. I mean, this is a change. Yeah. And we have to be real about it and acknowledge, you can debate the science all you want, but the reality is here. And Alaska is on the cutting edge, and we should be figuring out everything we can do in this arena. And the UN, you know, you can debate, is it 2030, is it 2030? It's coming. It's the real deal. And this is not maybe for some of you in this room or myself and our generation, but it's going to be for the kids that I saw at the university yesterday and what they're going to have to tackle. And we have to be serious about how to deal with this issue.
So I'll ask you the same question I asked Dr. Kaplan, which is in terms of leadership advice and counsel, as folks are trying to figure out how to navigate this political time, other than voting for you for governor.
That's the best advice I can give.
What leadership advice and counsel would you give these senior folks and policymakers as they try to figure out how to improve and make healthcare a more sustainable industry?
Well, first thing I'd say, and I don't mean this sarcastically, try not to watch too much TV on the news, and try not to get caught up in the Facebook and Instagram and Twitter garbage that goes on. I think there's a lot of hyperventilating that goes on every time some issue happens, and before you know it, that becomes the policy. Mm-hmm. And I think this environment we are in today, and the public policy environment, is so, as I said at the beginning, very toxic, that we have to figure out, as not only leaders that you all are in healthcare policy, but leaders who are elected or running for office, we have to step back and figure out how to resolve these issues in a much more calmer environment. Otherwise, we're never going to tackle these big issues. And it's a challenge, because what happens is you all see the big picture, but you're also struggling with your day-to-day challenges. Maybe a regulation that's being put in and that impacts you, or a funding mechanism, or lack of funding, or new rules on how many beds you can have or how many beds you can't have. All these different things that are happening to you, and that's where you get kind of hunkered down into. And you have to step back, and I think that's part of what you do here, is you step back a little bit and say, okay, out of your normal everyday life, what can we be thinking about to change the dynamics of healthcare delivery? And then you have to find some champions, people who care about this issue, who are not afraid to take on tough calls and are not afraid to be innovative. If you're just finding people who just want to help you with a regulation or money, that's one thing. But what we're missing in the healthcare arena, in my opinion, is people who really, in the public policy, are willing to step out there and think creatively and think of the long play, not the short game. And I think that's what I would recommend to anybody talking to folks. And then when they do the right thing, you got to be out there and thank them a lot, because the political environment today, it's a churn and burn. Meaning that you can get in, and before you know, within a few days, you're just burned and you're thrown out on the deck. I had a guy yesterday on a radio call in. He says, "You are the 60th vote of Obamacare, blah blah blah." I've heard that thing, and every. I said, yes, I was, because 44,000 Alaskans now have Medicaid that they didn't have before. They're not coming through the emergency room at the highest cost programming in healthcare than ever before. They're now actually getting some preventive health care and some other care. Yes. Was it perfect? No. Does it need to be improved? Yes. But you have legislators in Washington, D.C. that take it as a political issue instead of doing what they should be doing, trying to solve the problems every day. That's, I think, what I would recommend is you got to find those champions, not be afraid to kind of boost them up. They're not always going to agree with you. Don't torch them when they don't agree with you one time. When they agree with you majority of the time, support them, help them, get them down the path, and look for these creative solutions. And don't be afraid when people say, well, the law says, and then you can't do it. Well, hell, the idea of elected officials is modify the law. When I was mayor and they kept coming to me at times, they said, well, the law says this. Well, I'd look at them, I said, well, aren't we the elected body? Can't we make it work? And the answer was always, well, I guess, yeah. So that's the advice I'd be given.
Well, I think I will just conclude to say, I think that in this time in our American politics, we need more places for constructive disagreement, more places for constructive engagement. And I think regardless of how one votes in November or what one thinks of your political background, I think everyone can and probably should appreciate the fact that you're willing to talk about these issues. Mm-hmm. You've come here to stay reform twice, in particular during your re-election campaign, which was a tough time to talk about healthcare. I appreciated it then. I appreciate it now. Thank you very much for being with us. Candidate for governor, Mark Begich.
Thank you all very much. Appreciate it. Thanks.
Very good, sir. Thank you very much. Appreciate it.
Thanks.